why, but somebody talked me into going to a Cardinal game on August
Did they win that
8th,
night?
and I think it's during the day. I'm like, why am I going in August during the day?
Yeah.
At least go at night. Maybe it's not. They're supposed to have a big concert at Busch Stadium with Zach Brown Band and Sam Hunt, August 13th. Can you imagine the heat and the people?
Yeah. Need to get a water.
I got a baby one.
I don't know. I watched the other night, stayed up late and watched it where they blew 6 runs in the bottom of the ninth or top of the ninth. I was like, why do I do this?
Yeah,
Haven't followed
really.
at all.
It was a nail biter yesterday even.
They come in and they walk everybody, right?
Yes. Yep. I think I would be having a serious conversation with those pitchers. Say, you don't shape up, we're shipping you out.
They brought in so many extra,
They're supposed to be still looking.
are they?
Mm-hmm.
So is it a concert within the team or is it?
No, it's a concert separate. Zach Brown Band and
Also, there's not a.
yeah, it's just a welcome back St. Louis or something like that.
Yeah.
And they just put
Yeah,
in the mask man.
What they do to that field,
So
they can't be there all weekend. We went to Kenny Chesney a couple years ago, and they cover the field with a plastic flooring that has that would drain if it would rain. I guess to protect the grass and the stage and all the lights and stairs that go down from the ballpark village area. They build stairs big wide stairs to get down to the field, and
wow,
it's pretty. It was actually pretty cool to see how they
involved in how they did that.
how much work goes into putting that together.
Are we okay?
Yeah.
It was good. It was Old Dominion, Thomas Rhett, and Kenny Chesney.
Wow.
Oh, that is.
It was really good.
I tell you what,
It was good.
UPC
It
has
started
some
pretty
good-
early. We missed most of Old Dominion.
ones
They
coming.
were just starting out.
A lot of variety this year.
I like it.
Yeah, he was good. And his little family was backstage, the little girls dancing around. And yeah, she goes, I think, to about everything he does.
I got the chair.
You can switch the one next to it.
Little by little, pretty similar to C Dash's
She's the
hat.
slightest person here, too.
I think it's probably my son's.
It goes down a lot faster when I send it out.
Just.
You go by the computer.
Oh, okay.
What's that?
It's 6 o'clock. Call this meeting to order. Please rise and join me in the pledge. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call. Robin Klosterman. Here. Brad Waldup. Jill Windling.
Yes.
Jane Willenberg, yes. Chad Thompson.
Yes.
Esther Ware,
Yes.
Steve Bone, no.
All right, do we have any visitors this evening that would like to address the board? Okay, I have a statement I'm going to read. Before any visitors address the board each time, we're going to read the statement. Unit 40 Board welcomes comments from our community during this time. Speakers are limited to 5 minutes, and we will notify the speaker when there is 1 minute remaining. We ask that all speakers identify themselves and share their information in a respectful and courteous manner without the use of profanity and personal attacks. Please keep in mind your audience may include children. We appreciate your anticipated cooperation and welcome any comments that will benefit our goal of supporting the best education for the students of Unit 40 schools.
Do I just push?
No.
No.
It'll be open.
Thank you. Hello, Mr. Dome, Mr. Fox, and members of the school board. My name is Michael Lampkin, and I am the new president of the ECTA. I would like to start off by saying that I'm happy to serve in this position, and I look forward to working with all of you in the coming years to help foster a welcoming and healthy environment for our students and our staff. The main reason as to why I am here today is to raise some concerns from the ECTA members that have been brought up in regards to the back to school plans that you are currently discussing and voting upon today. We had a couple concerns regarding the survey in particular. And these are just some of the comments that I've gotten from members. People are saying that the feedback section of the survey was very limited. It was limited to 140 characters, which is around the same as sending a tweet. So we thought that some of the members and some of the community members weren't having an opportune way to actually put in their feedback instead of emailing board members or the entire board their entire concerns. So we were hoping that if we were to have some more room for discussion from the community, that we have a chance to express more of our feelings towards that. People are concerned with the rising numbers of the cases for the Delta variant with students ages 12 and below. That's around 3 schools of our population, with Southside, East Side, I believe, ELC, and Central. So with that being said, there's just a lot of concerns as to people coming into the building, who's vaccinated, who's not vaccinated, and making sure that we are keeping them all safe through this time. Some of the members were also concerned about visitors coming in, and I know that was one of the topics that was mentioned in that survey, and how we're going to decide whether we're going to show vaccinations or not show vaccinations. Again, this all is probably going to be discussed tonight, and I hope that it is discussed in a manner that will be beneficial. And then I just wanted to read off, I'm sure you all saw the health department release that was released yesterday, but I just want to read that off for everyone to show that the health department is evaluating all that stuff. So as they say, as students and staff prepare to return to school, the Effingham County Health Department would like to remind the community that the wearing of masks in unvaccinated individuals and the continuation of mitigation strategies is very important to reduce the spread of COVID in our community. The department is beginning to see an increase in positive cases, and we know the Delta variant is present in our county. The following prevention strategies and the updated guidance for COVID-19 preventions K-12 schools from the Center of Disease Control and Prevention are recommended. Promoting vaccines, consistent and correct mask use, physical distance, screening, testing to promptly identify cases, clusters, and outbreaks, ventilation, hand washing, and respiratory etiquette, staying at home when sick and getting tested, contact tracing, and cleaning and disinfecting. What I'm asking for all of you to do is to seek more answers and feedback from the community and staff where they can truly express their thoughts and how to return. While we are wanting to return to normalcy, we are simply not there yet with the way things are going, and all we want to do is to keep our teachers, staff, students, and communities safe. While a decision may be made today, I hope that we are able to follow protocol or implement any future changes that may be made by the Effingham Health Department, IDPH, ISBE, and/or the CDC to protect our community. I thank you all for your time, and I look forward to working with all of you in the future.
Thank you.
Thanks.
Anyone else? All right. Mr. Fox, financial report?
Okay, we finished June with net fund balance of $24,376,000. $244.85. Operating funds finished with $19,025,481.99. And HLS funds had $3,461,508.34. We received revenue in the education fund locally, $81,368.61. From the state, $567,762.86. And federal, we received $128,805.51. All expenses over $5,000 are broke out separately in your packet. And our recommendations this month are to reimburse the interest account in the amount of $3,630.39 and the payment of bills in the amount of $3,027,073.38. Of that, $1,048,284.36 were the HLS project at the junior high. So, are there questions I can answer?
Anyone have any questions for Mr. Fox? All right, then I'll entertain a motion and a second to approve the financial report, excuse me, to reimburse the interest account in the amount of $3,630.39 and the payment of bills in the amount of $3,027,073.38.
I'll make a motion.
Chad makes a motion. I need a second.
Second.
Jill seconds. Roll call.
Jill Winling,
Yes.
Jane Willenberg, yes. Chad Thompson,
Yes.
Tricia Ware,
Yes.
Robin Klossman.
Yes. All right, moving on to the consent agenda. We have minutes enclosed this week from June 28th, our regular meeting, special meeting on July 15th. We have no cafeteria report. We have one student teacher proposed to student teach at Central with Missy Donaldson in the 4th grade at Tyria Baker during the first semester. Fundraisers, we had four fundraisers. The EHS football cheerleaders want to sell raffle tickets for a whole hog to raise funds for new uniforms, POMs, etc. in July and August. The Central PTO wants to sell school t-shirts and sweatshirts to increase school spirit in August and September. The EHS boys basketball team wants to do an online fundraiser for people to donate. Team members will submit names of people to contact for donation, and it is to raise funds for necessities not covered by the athletic department budget in August through October. And the EHS girls track and EJHS cross country wish to raise funds for supplies for cross country and track programs by selling 50/50 raffle tickets September 3rd to October 22nd, which I'm assuming might be football games. I'm not sure.
Yes.
All
We
right.
started that a few years ago.
And we have no field trips. Any questions or discussions on anything in the consent agenda? And I will entertain a motion in a second to approve the consent agenda.
Motion.
Jill makes a motion, second. Gotcha, seconds, roll call.
Jill?
Yeah.
Jane, yes. Chad?
Yes.
Tricia? Yes. Steve? Robin?
Yes. And we have tonight correspondence. Effingham Unit 40 Board and Staff, thank you so much for the beautiful stepping stone in memory of Nancy Walker. Your thoughtfulness was truly appreciated. The Nancy Walker family. Nancy was a former cook, retired in 2001, who worked for us for 21 years. That is the only correspondence we have this evening. Before we move on to the superintendent's report, this seems like an appropriate place. I want to put a little plug in for the survey that we are asking community members, staff, employees, and so on to help us in our superintendent search for next year. That has been advertised on our webpage, and I think the media has posted some things about it. It was released last week, just after the back to school survey, so I don't want people to confuse the two and think it's the same thing. I did check, and we had about 80 responses was all so far. So we'd like to hear from a lot more parents and teachers and staff and community members I think it's available through the end of August, and it's available through links on our website and so on. So hopefully you'll help us identify the qualities and profile of the next superintendent of schools after Mr. Doan retires at the end of this year. So put in a little plug there. Please help us out. All right, superintendent's report.
Tonight, I don't have really, the foundation didn't meet and we have no new FOIA requests. And so I don't really have anything to add.
New business then. We have Jason, SEPCO Food Cooperative bid.
Every year, Unit 40 kind of heads the Southeast Purchasing Cooperative, which is where we buy the majority of our food for the kitchens. There are 25 or 30 schools that belong to the co-op. So when we pool all that food purchased by all those districts into one pile, we get a pretty good rate back. This year, we sent bid solicitations out to U.S. Foods, Cisco, Gordon Foods, M.J. Kellner, and Cole Wholesale. And the only person to return a bid back to us was Cole Wholesale. So the total for everything submitted was $1,357,329.05. Now that's if the exact same amount of food was bought this coming year that was actually bought in 18, because they took out 19 and 20. They didn't want numbers from those 2 years because they were both messed up because of COVID. So our recommendation would be to accept that bid for the SEPCO program and move forward with Cole Wholesale.
All right. Any questions for Mr. Fox about the food cooperative bid? All right, then I will entertain a motion and a second to accept Cole Wholesale's SEPCO bid for the 21-22 school year.
I'll make the motion.
Motion by Dasha. Is there a second?
Second.
Second by Jill. Roll call?
Jane, yes. Chad?
Yes.
Desha?
Yes.
Robin?
Yes.
Jill?
Yes.
All right, next we have health insurance. Mr. Fox?
Okay. I'm actually glad to be talking about this year.
For once, you're
Yes. Last year wasn't bad because we stayed at the same. This year's even better. So every year we get together with Weiss Insurance. We talk about our previous year. We talk about the claims we had, the number of claims, how many large claims, how many small claims, and we apply for renewal rates with Blue Cross Blue Shield. We try to look at both fully funded, which means the liability falls on Blue Cross Blue Shield, and we also look at self-funded. If you recall, about 5 years ago, this district went to self-funded and took on a majority of the liability that comes from that. And so we've been keeping track of where things have fallen over those years to see if it was a positive or not. This coming year, we are looking at a 3% reduction in the insurance premiums for self-funded. Fully funded would have been about equal to where we were at, a little bit above. Self-funded is a 3% reduction. So we've kept a chart as well to kind of look at self-funded versus fully funded. In 2017-18, an employee only had a premium of $867.85. Here we are in 2021-22, and they are looking at a premium of $870. So less than $3 more than what they paid in 17-18. And that's for a $500 deductible. So the rates that we're seeing this year are barely just a few dollars more in each of our categories than what they were in 17-18. So we're pretty pleased with where self-funded has allowed us to keep our overall employee rates, the premiums. So, are there any questions about the rates? We would ask the board to accept these rates for the upcoming year, which
There's a
will
little historical. Last year, we started at the insurance committee. We bid out insurance, and then COVID hit. We did get, I think, two bids,
Two, yes.
2 or 3 bids, and the committee recommended we continue the same. And so once we got the renewal rates, I think, Mr. Fox, you had discussions.
We met with both the support staff and the teachers union and showed them the process and how we came up with the numbers, made sure that they understood that process and offered for them to give feedback on it. And of course, with the 3% reduction, everybody was pretty pleased with that at this time. So.
Anything else on the insurance for Mr. Fox? All right, then I entertain a motion and a second to approve the renewal of Blue Cross Blue Shield Health Insurance and set the premium rates for 21-22 as presented.
Make a motion.
Motion by Chad, second.
Second.
Second by Jane, roll call.
Chad,
Yes.
Desha,
Yes.
Robin,
Yes.
Jill,
Yes.
Jane, yes.
Next, we have a board policy update and changes. Last month, we posted policies for review and public comment. So tonight, we need to adopt those changes. I'll entertain a motion and a second to adopt the following board policies as presented. Section 1, policies 10, 20, and 30. Section 2, policies 10, 20, and 30, 130, 240. Section 3, policy 30. Section 5, policy 10, 30. Section 6, policy 100, 145, 160, 170, 235, 255, 260. Section 7, 220, 230, 280. Section 8, 90. Anybody want to repeat that? You can. I need a motion to that effect. I'll make that motion. Is there a second?
Second.
Second by Dasha. Roll call.
Desha,
Yes.
Robin,
Yes.
Jill,
Yes.
Jane, yes, Chad.
Yes.
All right. Next, we have our plan for safe return to in-person instruction and continuity of services. Mark?
Okay, so gathering information and input from CDC and guidance from IDPH. We put together a draft and shared that with everyone, and was directed to put that out as a, we'll have to turn that on. I got the chair shrunk too.
There it goes.
I'll just move over a little bit, so I'll spread out. Okay, so as I mentioned that put a draft together with options in regards to the plan for safe return in-person instruction, continuity of services. There was an overview, there's different sections. And so to gather input, we put that survey out for each section, and we kind of want to share that information tonight. And then if we want to, we can talk about each section, or if we want to go through all the survey results and then come back to each section, or I don't know how you want to do that, but the idea was we'd show the section and have a discussion, or however you want to do that. So we'll make that determination as we go. So I'll let Emily talk a little bit about this as the information is put together.
Yeah, sure. So last week, so this ran from Tuesday to Friday, we put the survey out. It was on the school's website, Facebook. We sent out notifications to the app and through voice messaging through the phone. So if you heard a new voice, that was my voice, if you heard that. And so we had a total of 690 responses. We used a Likert scale, with 1 being strongly disagree and 5 equal strongly agree, just so you can kind of know the range there for when I show you the numbers. And there was a response box if people wanted to add additional feedback besides just choosing a 1 through 5. Do you want me to go ahead and
Sure.
do those? Okay, I know it's kind of hard to see. This is, but your different bar charts I thought might be easier to look at here. So this dealt with this section dealing specifically with operation, talking about the school being 5 days per week from 8 a.m. to 3 p.m. So what you can see at the bottom there is on the left, the 1s are your strongly disagree, the 5s are your strongly agree. You can see again, out of 690, we have 557. You can kind of see, it gives you the number and then also the percentage. So you can kind of see those numbers there. You don't need to read those, do you? Okay. If anybody needs me to linger longer, just let me know. Mask use, so with the parameters that were given within this survey, this was the percentages for responses. Again, 1 being strongly disagree, 5 being strongly agree. You see the numbers and the percentages there. Social distancing parameters that were given within the survey. Hand washing and respiratory etiquette, the parameters that were given for that.
Is this viewable on YouTube? I mean, can they see?
I can't see it.
So should we be reading it or not?
Okay, we can go back.
Because when I went into it so they could see it, it's backwards.
Okay, well then,
You know, like looking in a mirror.
Just so people can kind of hear.
Sure.
I don't know why that is.
let's, we can back up.
Yeah,
Thank
do you want me to back up?
Is it streaming through your laptop?
Yes.
So I do this for the games. It'll do a reverse on yours, but on everyone else's, it should be normal. It's really weird.
So do I do it, what do you want?
So we should be able to see it normally.
But
What I'm saying though, is it zoomed in enough
Yeah.
that they can actually see it?
let's just go back and we can say, we can
Sure.
share the numbers.
I can zoom it in, but it's backwards.
But he's saying on other people's computers.
When it's right,
Oh,
yeah.
yeah. see it.
So the main one that is streaming it is the one that.
Okay, so they can actually see it. So then I'll go back, because I did zoom, and then
We'll go ahead and go
So
back.
for operations, strongly disagree was 3.9%, 2, those who ranked a 2, 1.9%, a 3, 5.8%, a 4, 7.7%, and then a 5, 80.7%. For mask use, a 1 being strongly disagree, 15.1%, a 2, 5.4%, a 3, 13.5%, a 4, 17.2%, and then a rating of a 5, which is strongly agree, is 48.8%. And then we have social distancing parameters, 1 being strongly disagree at 11.6%, 2 at 7.5%, 3 at 19.6%, 4 at 21%, and 5 being strongly agree at 40.3%. Hand washing and respiratory etiquette, strongly disagree being a 1 is at 2%, 2 is 0.4%, 3 is 4.9%, 4 is 12%, and 5 meaning strongly agree is 80.6%. For contact tracing in combination with isolation and quarantine parameters, 1 meaning strongly disagree is at a 9.9%, 2 is at 7.8%, 3 is at 19.3%, 4 at 22%, and 5 meaning strongly agree at 41%. Facility and transportation, cleaning, disinfection, and ventilation. 1 being strongly disagree at 3.9%, 2 at 2.3%, 3 at 12.6%, 4 at 18.7%, and 5 meaning strongly agree at 62.5%. Screening and testing, 1 being strongly disagree at 9.6%, 2 at 2.8%, 3 16.2%, 4 at 19.7%, and 5 strongly agree at 51.7%. Promoting vaccination, 1 being strongly disagree is at 18.8%, 2 is at 4.6%, 3 19.1%, 4 14.6%, and 5 strongly agree at 42.8%. Visitors, 1 being strongly disagree at 9.1%, 2 at 5.5%, 3 at 16.4%, 4 at 19.1%, and 5 strongly agree at 49.9%. Collaboration with public health officials, 1 strongly disagree, 5.4%, 2 is 4.8%, 3 is 16.8%, 4 20.3%, and 5 strongly agree at 52.8%. Regarding disabilities or other healthcare needs and the parameters regarding that, 1 strongly disagree at 2.5%, 2 at 1.4%, 3 at 16.1%, 4 at 19.1%, and 5 strongly agree at 16.9%. And then additional details to Unit 40 reopening plan. This included student meals being free, the IHSA parameters when it comes to extracurriculars, athletic programs, field trips, absences, PE uniforms, grading, GPA, graduation requirements, and exams. 1 was strongly disagree at 1.7%, 2 at 1.2%, 3 at 7%, 4 at 14.5%, and 5 strongly agree at 75.6%. And that is it.
Okay, so you just want to go through each section and talk about each, or however you want to?
Or, yeah, that's fine.
Okay. Mainly the overview is the overview of the process, and then some instruction about remote instruction. Just a reminder that per ISBE, and again, this is what's being put out there, whether it wants to be approved or not, will be available only for students who have not received the COVID-19 vaccine or who are not eligible for the COVID-19 vaccine, only while they're under quarantine consistent with guidance with the local public health department. Just a reminder from everybody that only the health department can put somebody into quarantine or let them release them. The school does not put students, staff, or anybody into quarantine or release them. That's a health department process. And
I had a couple of things on the overview section. One, I question the use in the 4th paragraph. The 3rd sentence says school strategies and or mitigations in this plan may be removed based upon blah, blah, blah. Removed. I question that we would remove that, or would we revise them or alter them? I mean, we actually could be adding things. I mean, we don't know.
right.
And so I just wondered if maybe removed wasn't the correct word there. They may be revised, they may be altered, or whatever, but based upon, that was one of the things I questioned. And then local conditions, levels of community transmission, local vaccine coverage is there. I guess, and I think this is a question I've been asked by a lot of people. What are those levels? What are those standards? I know that's where we come to, I think we're looking to the health department, and I know we've met, so maybe you want to address that a little
Yeah,
bit.
we had a meeting, we called, the school districts asked for a meeting last week with the health department. And that was one of the main questions about what are those metrics going forward in regards to whether schools or districts need to be shut down. Their response at this time is the IDPH was to prepare or provide them with those metrics. They have an update on the use of those, and they have not received that as of our meeting last Wednesday afternoon. I did ask to clarify at the meeting, we did ask to clarify, are we going to use community metrics for like just Effingham? Or are we going to use community metrics just for T-Town? And they said the metrics that they would be using, absent any new information, would be county metrics. And so those county metrics can be found on the IDPH website. But then I ask, what, those are July, they're 2 weeks behind. So, how do we, closing of a school is something that would be done by the health department as a recommendation, not from superintendent, that would be brought forward. So we pushed back to the health department in regards to, you need to provide us the metrics so we can get those out there so everybody can see them. We don't have those. So
Were there metrics being used last year that guided policy? Because I almost feel like, I don't even know if the health department was prepared to look at these metrics and provide guidance.
Right.
Because, it says that, so levels of community transmission, local vaccine coverage, and use of testing to detect cases in K through 12. So if you go on the CD website, it says level of community transmission, and you put in Effingham County, there are 3 categories. You're either low, moderate, substantial, or high. Right now, we're at substantial. I'm kind of surprised by that. I don't even know how, that's what it says we are. And if you look at the CDC's guidelines, it says, CDC guidance recommends layering multiple prevention strategies, especially in areas with moderate to high community transmission. So if we're already in that category, then aren't we supposed to be, if we're going to follow the CDC, then aren't we supposed to be layering our mitigation, which includes masking people who are not vaccinated?
Well, I mean, yeah, that could be a possibility. I think that's a decision. And again, we're asking for direction from the health department in regards to what's the definition of high, moderate, what was the other one? Substantial.
Yeah,
Right.
low, moderate, substantial, high.
And then there's also talking about those have to be, if I remember right, those have to be in regards to for a 2-week period. I'm thinking that, yeah. So they have to, it's not just 1 week, it's a 2-week.
Sometimes they break it out either a 7 or a 14-day average.
Yeah.
And the other thing that can sway those statistics from time to time, if you have a high concentration in one particular facility, like a long-term care facility, like what happened in Mount Vernon, then that can sway your numbers substantially for one county. I do know that the health department was identifying an outbreak as 5 or more cases, like in like a manufacturing facility has been my experience with that. And that's when we would determine to layer different preventive strategies, as if we had 5 or more cases in one facility or not.
So, I understand the health department is looking for guidance from IDPH, saying that, okay, with these numbers, maybe this is our guidance, but I'm just wondering what they used last year. I don't.
They never came up with metrics last year.
Okay. And so, again, for what's a low percentage of vaccinated people? Right now, we're at 32%. Is that considered low? And would that again be trying to propel us to maybe take greater measures here? I would consider that a low number.
Yeah, I don't know.
If you look, I forget they have a page that shows the percentages in every county in the state.
Yeah.
In comparison, I forget, let me see if I've got that. And it is low. Actually, they'll show that, I think they show 44, 46%, but that's 1+ shot. And then they'll show fully vaccinated at like 34. So I think that includes people that have had 1 shot of the 2-shot series. So anyway, it's lower than I looked at some of the plans that we have been looking at, like Mount Zion. We're lower than Macon County. We're lower than Champaign County. We're lower than, like we looked at Muhammad's plan and we had looked at Mount Zion, and those counties have a higher vaccination rate than we do. So.
Do we know, does it show how many positive cases they have as well in comparison?
I haven't gotten there yet. Let me see.
I think they're using 7 days.
7-day rolling
No,
average.
this is
It's a 7-day rolling average.
Yeah, this is through July 3rd, right? So this is a couple weeks old. And I think just Friday, every Friday they update that from what they mentioned.
And usually there's no reports for Saturday and Sunday.
Yeah. So as of that was the 9th, Region 6, we had a test positivity of 1.6%. Effingham County at 3.2%. There was another email. Let me look.
Yeah, I think the data changes depending on where you're looking and how current it is. I got this email from COVID Act Now, which they show all the counties in Illinois, and they show our positive test rate right now at 4.2.
4.2.
Just came today, yeah. Vaccinated, 1 dose plus, they show 45% for us. Champaign County has 63% vaccinated. That would include Mohammed. Their positive test rate is 1.9%. And who was the other one we were looking for? Oh, Macon, right? Macon County has 50% vaccination, and they have a 2.2 positive test rate. So those were the two that we looked at, Mohammed and Mount Zion. I think that part of the issue is just that when you talk about metrics and what those decisions are going to be made on, it's a slippery slope right now. I mean, nobody seems to be ready to say this is what we're looking at. I think that's why it's just real hazy, and that's why I feel like we're making our decision no different than every other school district around us based on public opinion, not on data, because we don't really, like I said, what's the cut line, or where do we become more concerned? Where do we add more mitigations or take them off? It's like we could look at numbers, but what is our goal? What are we aiming for?
Right.
I think that's where it gets a little hazy. So, but I have the same concerns that Desha has about that.
Well, one of the things that we've talked about, even at our last meeting last week with the health department, is as soon as that information, they do get updated from IDPH, we will have another meeting. However, this came out July 9th. And my question was, well, what update are they going to have? July 9th, we just had it. Yeah. And so, what they said is that there's a meeting and the information is there. It's just not been released yet now. That's all I can tell. I don't know. I don't have the answer to that answer. Fair question.
I think we have to keep striving to find out what those metrics are that can be monitored and what would.
I'm not really sure we're gonna get the answers we want from the metrics either. I think that's why, like in a situation like this, you kind of got to look at the big picture. Like what do we want to do? And you can tell from the surveys what the public opinion is, and what probably the majority of the opinion is on the board too. Usually reflects the general population. But these decisions, they don't affect all families equally. And when we decide that we're going to send everyone into a school that is the majority of them have no vaccinations, and we're going to say that the CDC recommends that you wear a mask, but you don't have to, then what we're generally saying to those families is that your kids aren't safe in school, so you're going to have to remote learn, which is, that's probably the best decision for them, to keep their family safe. But is that the right decision for us to make to help protect them? I understand that not every, it would be very difficult for the board to say, we're going to mandate masks for everybody. It's not going to happen. But I have a hard time understanding why at least the teachers can't do their part in protecting their students. If you are vaccinated, bring your card, show the vaccination, you don't have to wear a mask. If you're not vaccinated, I think you should wear a mask until the whole population gets the chance to vaccinate themselves and their children. Because there are lots of families that they're going to have kids with health conditions like obesity, diabetes, immunocompromised, cystic fibrosis, severe asthma. I don't know how many kids in the school system have those conditions, but I think those kids would probably be safer staying home. And then on top of that, we're going back to a full school, 8 o'clock in the morning to 3 o'clock. So how are the teachers gonna have time to do remote teaching when they're in the classroom all day? Who's gonna do that? Are we hiring more people? Are we gonna designate teachers to do that remote teaching? I mean, those are questions that I have.
Well, right now, it's very limited who can be on remote learning.
Correct. And there's parameters for that from the ISBE. There's also home hospital instruction, which is a different situation, which would be handled, basically, the way we've handled it per the law is that you only provide 5 hours of instruction a week. If there is a rare occasion of a student that cannot be there for whatever purpose, medically approved and all of that, then what we've talked about is using Apex, the software that we used over the summer and in the spring, to keep those students engaged in those classes, that we would hire a staff member separately to oversee that, not teach it. It's to make sure that they're following along and making sure they're doing the curriculum. That's the other option, because we don't have people to hire. So the choice is, if we're going to be in school full days, that's the process we're going to have. Otherwise, we go to partial days where we have time during the year or during the day. And like we did last year, where we used one teacher per section.
Do you have an idea of how many students would, because of
No,
medical reasons, would be staying home?
No.
No idea.
it would be very limited, because the parameters for remote learning are what I read earlier in regards to if they're not eligible for the vaccine and they're on remote learning, which most of our staff through last year, we've done using either Seesaw or Google Classroom, have provided that information, which is much better than what we did in the past of collecting work and just sending it home with no instruction. That's what we did in the past, and most districts did in the past. But now that we have the option of Google, we went to one-to-one and have Google Classroom and Seesaw, that instruction can still be provided. It's not as good as a classroom.
So I'm a little bit confused by that then. So if someone, say, their physician, recommended to them that they not do in-person learning unless there was a mask mandate, then a physician's order would not allow that student to stay home and get remote learning.
Not unless it falls under the home hospital parameters, but there's got to be a medical reason rather than, I think the comment you made was.
No, medical reason. I'm talking
Yeah,
about
okay.
medical reason, yeah.
So we don't anticipate a high number, because basically those parameters are the home hospital is and considered from a legal standpoint of what we've done in the past, a limited short-term fix. So it's kids that possibly had a broken leg, something of those lines, they couldn't get out of the house, whatever the case may be. They were on home hospital instruction for a short period of time and then back into school in a short period of time. On those that are, which were longer in term, then it depends on the situation as whether school is that important in regards to the situation. We've had that because of grave illness. So those are the options at this point. If the board wants to make sure that we provide instruction to students for any reason outside of those scopes of ISBE, I guess we could, but that hasn't been a directive in regards to for the district. And we would still want to look at Apex, because we can't find extra teachers, because that's what we'd have to do.
I know Apex is only down to grade 6, is that correct? That would not
Yeah.
involve K-5.
Yeah.
They would have to be on something different, Google Classroom, something like that.
Well, they use a Seesaw format is what they would use.
But not Apex, yeah. Yeah, I have to chime in on a couple things that Dasha said there. I agree with her that, you know, requiring students who are unvaccinated to mask is something our community probably isn't going to bear. I understand that. But I do agree, and it might not be popular, but I do agree that I feel as an employer, we have a responsibility to make our classrooms and buildings as safe as we can for our students. And to do that, I feel that our employees should be vaccinated, provide proof of vaccination, or be masked. Now that would be their choice. We're not saying you have to be vaccinated. We're just saying one or the other. Of course, it protects the teacher somewhat, or the employee. We know how hard it is. I mean, we know in-person learning is our goal. It's the best with students and teachers. And you know, we had a wide swath of teachers out last year, and substitutes were not easy to get and are never, as good as some of them are, it's never like the real thing. So that would be one advantage. And then the other, of course, is that it not only protects the person wearing it, but it protects others from increased transmission. So we would be protecting the kids that we have that are not able to be vaccinated, or whose parents have chosen not to vaccinate them and are unmasked, if that's the choice that they're making. So as an employer, I feel like we have that responsibility almost to make our classrooms as safe as we can for our kids. I was talking to somebody about that, kind of bouncing them off, and they said, oh, what about HIPAA? Well, HIPAA doesn't have anything to do with that. So if that's going through someone's mind, that HIPAA has nothing to do with that. You can ask, an employer can ask, you know, an employee for information. That employee has the right, you know, not to provide it, and to be masked then if they don't want to provide proof of vaccination. So anyway, that's my feeling. I would really like to see us go in that direction, just to be responsible as we can, provide the safest environment we can for our students, knowing that although I too would feel better if our unvaccinated students were masked, I know that that is not something that's going to fly in our community. So I think for our students, it would be optional. So
I think one step in addition to that too, with the volunteers.
right, and that was something the ECTA mentioned, which I think kind of supports what we're saying here. They were concerned about volunteers and visitors coming in the building, and really that's no different than the teachers being there with the kids. So I mean, it's just like, you know, the adults. We need to do whatever we can to protect kids, and I would lump the visitors and anyone coming in the building in that too. Proof of vaccination or masking, whichever your choice would be.
It is, I mean, it's a well-known fact though that masks don't protect you or anyone else.
That's not true.
Yes, it is.
It's
You
not.
see it everywhere.
You see a lot of things everywhere.
Well, most of the masks don't fit correctly. There's gaps on the side and
But it's still, that's the reason why, for the most part, it can protect you from other people, but for the most part, you're protecting others. That's what they do. I mean, I know they work. I use them in a healthcare setting. I mean, I've been around COVID patients. I've had, you know, colleagues that have had COVID that I've worked next to. And we have all been masked. And something's working. Something's preventing us from, you know, contracting the virus. So, I mean, to say they don't work is not true. Are they 100%? Absolutely not. Does that mean that no one's going to get it? No. But to say they don't work at all is not true. I don't believe it.
even people that are vaccinated though can still get COVID.
Absolutely, but they do not get sick. They typically do not get hospitalized. They typically do not die. So those rates are way lower. And they typically do not transfer to other people either, can you?
But they can.
Yes, but that's the whole point of getting everybody vaccinated. I mean, we can argue about vaccinations, and I'm not saying anyone should get it or not get it, that's your choice. But what I'm saying is these children haven't even had the opportunity to get the vaccination. Their parents haven't had the opportunity to protect their kids. So once they get that opportunity, then hey, that's your choice. Either you want your kid vaccinated or you don't. And if you don't want them vaccinated, that's up to you. But until we have the opportunity to do that, then I feel like it's our responsibility to protect them.
You want to move on to the next?
Okay.
I mean, we can come out, we got to
Right.
make a determination or not on this. On the social distancing, are there any questions there? Basically from the health department, one of the issues is, social distancing was altered in the spring to help some schools get back in session. So that's why they said social distancing should not be used to not allow school to be in session. However, it's still going to be a 6 feet issue from the health department. Absent being vaccinated, from their perspective, if the student is vaccinated or staff member is vaccinated, they would not be quarantined. Otherwise, they would be. So one of the things we pushed for last spring was the reduction from 14 to 10 days, and even and staff down to 7, and the health department would not budge on that. They're more open to that, but there's been no final determination on that at this time. So one of the goals we're trying to do is get people and students back into school in a safe manner.
One of our biggest challenges was with lunch hours in some of the buildings. So are we able to do anything to mitigate that at all, or are we just back to?
Well, we had some ideas in regards to starting the school year before we decided to get out at 1 or 12:50 for the high school. We're looking at options of spreading people out, but we can't guarantee that 6 foot. We can't do it. Not go a full day. So we're going to do it the best of our ability. That's what we said from day one. That's the answer. One of the things about the mask issue, just in social distancing, it says you can use down to 3 feet if both students are masked or staff or most people involved. But it still doesn't stop you from, you can use a 3 foot section, but it's 3 foot distance. But if the mask does not stop you from being quarantined, even if you're wearing it. So, on that issue, it doesn't play a large role in that. So
So are you saying the mask doesn't stop you from quarantine if you're within 3 feet, or even if you're within 6 feet?
if you're within 6 feet,
There's no difference.
yeah, there's no difference. So the idea is
You're still in close contact.
So
you're,
6 feet away with the mask on, never in contact with the person for less than 15 minutes?
you have to have more than 15 minutes accumulative for a 24-hour period.
Within 6 feet, regardless of whether you have a mask on or not.
Yeah.
You're still in close contact.
Unless you're vaccinated, and then you don't have to be
Right.
quarantined.
Right.
As long as you don't have symptoms.
That makes no sense.
And see,
I know. So we have that conversation, and that's the direction the health department's going to go. Now, if that changes and this IDPH information changes, I don't know that it will, but that's the answer we've received. So one of the things I did bring up to the health department is the fact of last year people not being contacted. And it was a problem because, a parent would call the school would find out if somebody's positive before anybody else. So the school would call the health department and say, so-and-so is positive. Here are the names of people. Well, they were inundated, understand that. But some people would not get called.
What do you mean not get called? That
The
they
health
were-
department.
The health department would not call the people that were.
Close contact.
That were close contact or that were positive. Like you
No,
reported
close
that they were positive.
Probably a little bit of
They didn't
both,
call
because
back.
we had some staff members that supposedly we had turned in that they were positive and they never did receive a phone call.
Oh,
So, and I'm not saying that was across the board,
Right.
okay? But there were times at the end of the year last year, I said, look, here's when our number, our time, the time frame they're supposed to come back. Nobody's contacted these people. So unless you call me and tell me yes or no, we're letting them come back because it's been 14 days on our paper. And there were many Sunday nights. I know Mrs. Fox called me and say, look, I'm supposed to have these 2 teachers back tomorrow, but we haven't heard anything. And so I'd get a hold of the contact and say, look, they're coming back tomorrow unless you let me know.
Well, common sense would say that you should allow them to come back.
Yeah. So we,
And in their defense, I mean. they
Yeah, and
have both
I didn't.
It's a two-way street. The employer has to work with the health department to make that happen, because I went through the same thing with our facilities as well.
And I understand, and I was very upfront with them, and we had this conversation every week last year, and we had it again last week was the fact that understand that they were inundated, right? And there was just the numbers were out, and they hired more people, right? I mean, Penny even worked for them. And I requested already, I said, if we can't have that, because here's where the school sits. We get a positive, Kurt Roberts gets a call from a parent that says, hey, my son or daughter's positive, goes through and has 14 names, gives them to the health department. And that parent says, I'm sending them tomorrow because they're vaccinated. Well, we don't know that 100%, and so he's talked to them about, we don't want somebody that possibly has it or is a carrier or whatever walking around the school. So in last year, most people cooperated and didn't send their child or their student. We can't guarantee that's going to happen. So in working with it, what I kept saying to him was, look, understand our administrators called a lot of families and spent a lot of time on the phone. And luckily we had time during the day. They had time during the day. And even then they did it way late, just like the health department did as well. And I understand that. But basically the school district should not be putting people into quarantine and taking them out. It's a health department decision. And so they need to make sure that they make that phone call. And so we cooperate with them, but our administrators, working in regards to last year, I point blank told the health department, or asked the health department, could you go ahead and hire people now if you think you're going to need them? Because we've got to have people, not just for our district, but we got 5 districts in the county. And there were some districts that had more, positives than we did and some less, but we've got to address that issue. Before school starts, we start the 23rd, others are going to be starting the 17th, 16th. So, if we don't call those parents and let them know that, hey, your son or daughter is a close contact, I'm not sure when they're going to, because the health department said until they're in the state system as a positive, they supposedly legally can't talk to them about get their contract tracing and all that information. So we're kind of in limbo land there. And so from a district's point of view, you don't want students walking through your school that possibly are infected and spreading it. But on the other hand, it really is a health department issue. I mean, should be making those phone calls. So we've been making those phone calls, and I would assume that we'll probably continue to at least make people aware, so we don't have that situation. So, it's not the best situation there is.
Have we considered to avoid students being identified as a close contact and then having to wait being vaccinated? I mean, have we considered having them voluntarily, if they want to, provide proof of vaccination on file, just so that if they're identified, boom, you'd know immediately that they didn't have to quarantine? They wouldn't have to leave school?
I think that the parents that have vaccinated children want to do that. That's why
they did it.
Right.
But one of the questions comes up is then we go back to the very beginning. I mean, we possibly could do that, sure, but quarantining a student is a health department decision, not a school decision. So
it's pretty cut. It's black and white though if they're vaccinated. It's pretty black and white. I mean, for instance, at the surgery center, we have started asking people a while ago, through the beginning of the summer, for their vaccination cards. And if they provide that, then we are not testing them. So, I mean, it's no different. You make a copy of it, send it in. I mean, I think that would make it easier for the health department too, because then they wouldn't have to go through all those to call them to see if they were vaccinated. You could give a shorter
I mean, it would
list.
just
But
be a
you still have to
voluntary
ask them
thing.
whether they have symptoms or not. Because the health department's going to quarantine them. Even if you've been
If they have
vaccinated and you have
symptoms.
symptoms, they're going to quarantine them. So you
Right.
still have to have that contact.
Well, that's true.
I mean, in some situations that would work, in others it wouldn't. It's not a foolproof 100% one way or the other. One of the things in here I think is something about asking for vaccinations to determine or help determine quarantining. That's one of the things that the district could do. I think that's in there. Unit 4, it's on page 4. It says Unit 40 is not in favor of collecting COVID vaccination records unless it impacts quarantining procedures.
We could help speed up the process. And it's voluntary. What can it hurt?
What, seeking the vaccination information?
Yes,
Oh,
I
yeah.
mean, because it's gonna take,
Yeah.
take
I mean,
2
just
days
voluntarily,
just
if
to
they
get
wanted to,
whether or
you would
not.
have it on file, it would be a purely voluntary thing. But it would perhaps keep them from being quarantined even for a short time before they could prove they'd been vaccinated, and then they go, okay, go back to school, but now you've missed a day and a half already, or whatever. I don't know. It was just a kind of a speed up thing I was thinking about. If our goal is to keep these kids in school, and not have, we had a lot of kids out of school for many days last year, never got sick, but they were out many days. So, that's what we're trying to avoid, obviously, and still be safe. But
So we would seek vaccination records from parents for those students who are fully vaccinated.
Not
voluntarily.
seek. We're not asking them, we're not looking for it. If they voluntarily bring it to you, we will
Yeah.
hold in our records.
Mr. Roberts.
Can I ask permission?
You need to come up here, please.
In the process that you're talking about, what you're implying is that the school is going to be contacting all of the close contact individuals, letting them know they're a close contact. Is that accurate?
Was kind of my impression from what Mr. John had reported, that a lot of times last year that was the case.
That really wasn't what we were supposed to be doing. That was in our response to the fact that the
But you did.
health department was
Yeah.
overwhelmed and oftentimes couldn't get to those contact lists to let them know they were quarantined before the next day where that student would be coming back to school. So if we're talking about the idea that we would tell a student you don't have to be back or quarantined, that means that we're going to have to be making all those contacts, including the ones, and telling them that they're quarantined. And that, I just want to clear that because that's what we'll have. If that's what we're looking for, we will have to do that in every case.
I
What I
think
would, sorry.
obviously, the hope would be that the health department will take that role. But if we get an outbreak like last year, they'll probably be overwhelmed and it would probably fall back on you, I'm assuming. So
So I'm just kind
saying-
of, as start though, what you're saying is you're not anticipating or asking us to make those contacts.
No, what I-
Yeah,
What I envisioned is that we would have this volunteered information when you're told there's a positive and then you get the list of the close contacts, that you'd be able to reference that against the voluntary vaccination information and be able to share that with the health department when you tell them who those close contacts are. That way they know that you've already got verification that they are vaccinated. That would have an impact on their quarantine. So you're the only thing you're doing is sharing that information with the health department because they wouldn't have that.
And they'll already have it. They'll
have it, but whether they-
They'll double check it anyway.
Yeah,
That's the way I see it as well. I just wanted to make sure.
But I think Dash is right. At some point, they may get overwhelmed, and you may have to help
Sure.
that process.
Well, in that regard, that does help us as well as far as keeping accurate attendance as to whether a student should be there next day or not, and double check. So I just wanted to ask that question. Thank you.
Let me make a note here. Okay. Okay, what page are
Facility and transportation.
Okay, thank you. Transportation, cleaning, facility disinfection, ventilation. We would continue with the cleaning processes that were instituted. We're also looking with ESSER funds to add entire school ventilation, what's the word? Ionization, which would help with the air. One of the things in there is in regards to transportation is that mask would be required on all transportation. So we would offer, make sure that those are available for students it depends on the outcome of the other decisions, but making sure that if they're on the buses that they'll be wearing those masks. Now, there is no limit in regard, the 50-person limit on the buses is not in there, and it's not required or recommended. It's absent on the buses. So,
And the masking on the bus is a requirement of the CDC?
yes.
Yes, I could tell, I kind of thought on the survey, maybe people didn't know that.
Is there a protocol for equipment at the school? How is that handled for cleaning and stuff like that? Is it required that be cleaned in between classes or uses or?
You want to step up? Please, thank you.
If we maintain what we did last year, the same standards, which was what we're planning on, then elementary classes had equipment that was only used by each individual class, so it kept the containment to those particular classes. In PE classes, balls were cleaned between different groups that came in. A lot of times they did activities that didn't have equipment as part of the activity, so they did different races, things along those lines that didn't have equipment. So,
What about the ventilation? I know, didn't we purchase some new ventilation systems?
so last year what we did is we placed ionization machines in the cafeterias at every building except for the high school. And we also placed small units in the offices close to where the sick bay was. So if a kid had symptoms and was sent to the office, then the area that they were in, they were close to the ionization machine.
So I'm not well versed in these. Are these ionization machines, are they proven to kill the SARS-2 COVID?
Yes.
They are.
Yes, and I have that documentation I can share with you. So what they do is they are putting out positive ions into the room all the time. And so as the bacteria or whatever leaves the human body, they cling to it and kill it immediately. We actually implemented these in our ELC building 3 years ago to help with a situation. We had mold in a couple of the rooms here and there. And when we implemented them, we started tracking our student attendance, and we had 3 fewer students out sick every day that year than we had the previous 5 years. So we saw great results in air quality and what we were getting out of those machines. So what we're trying to do with the ESSER money is we would like to take those devices and not just do a cafeteria or an office. We want to put them actually in the HVAC ductwork so that we can treat the entire building, which would be all the classrooms, hallways, everywhere, through the same process. So we would be doing central in the high school first, And then moving into, because East Side is getting that as part of that remodel this year. Those came built into those HVAC units. And then we would do Central and the high school. And then the junior high, once the remodel's done, with the next ESSER grant, we're going to look at doing the junior high then. We didn't do it now because the rooftop units were not all installed, and I don't want to void a warranty until they're done and then get them put in right after that. So.
Thank you.
Mhm.
On the hand washing and at respiratory, that's kind of addressed in that. Let's see. 45. Let's see. Screening and testing. So I want to address just the potential testing. The district this summer has received a CLIA waiver, and in short common sense terms is the district can now use a BINEX test, which is an antigen test on students.
What does that explain what that is? I don't know. BINEX test.
Okay. Well, I don't know exactly between the PCR and antigen test. My understanding is that whether your body has the antigens in your body or not. It's a quick test. So what happens is, in the past, students would come down with a symptom, one of the exclusionary symptoms, which basically cover almost everything, because we're talking about fever over 104, but shortness of breath, new cough, sore throat, vomiting, diarrhea, loss of taste or smell, fatigue, those types of things. And so student came down with those, you'd have to follow the IDPH exclusionary guidance. Well, that means anybody in my house, if I was sent to the office with one of these, so any siblings in other buildings or a staff member who was a parent also was going to be excluded. And one of the ways to get you were out for 10 days, unless you had a diagnosis of non-COVID, let me use the right words, a medical note that it is needed to return to school, daycare, document there is no clinical suspicion for COVID-19, and indicate an alternative diagnosis with exclusion consistent with this diagnosis. So in short terms is, if you have headaches, maybe you're under the care for migraines. That's an example. And so then the second, if they're sent down a couple weeks later, the nurses know that student had migraines and already has that on file, and so on and so forth. But for those students that don't, parents would have to take them to a medical provider and get some sort of note, which is timely and costly. What we can do is, at the present time, IDPH allows students with a negative BINEX test to be able to go back to the classroom. So we looked into this and talked to a couple other school districts who started this in the spring. And basically, we talked to the health department that basically the school's on its own on that. So we will go through the state of Illinois to get the IDPH to get the BINEX tests. And then our nurses in those situations where students come down, we would seek voluntary parental approval. If the parent says, no, we don't want our student tested, fine. We don't test them, and they're out for 10 days, or they get a note and they can come back. If they are allowed, and the parent says, yes, we'll test them. And if it's negative, we go back to classroom. I just want to be very clear. I think the board needs to understand and the public needs to understand that doesn't mean that's going to happen within that 30 minutes or an hour of them coming down to the office, because there's other things going on. And so it may be the goal is less than 10 days, and we'd like to do it within the next day, if not that day, but I can't guarantee that somebody comes down at 3:00 and we don't have a note on file. We have to contact the parent, and maybe the next morning, or so on and so forth.
And does the nurse have to give the test?
Yes, they have to be trained, and so we have to.
Two nurses.
And so one of the things from the health department and from IDPH is you have to make sure you turn in the test results. I don't know why that's a big deal. I don't know. We would do that anyway.
I'm sure they have to track the data.
Yeah. So, but they sent something out that there's criminal penalties if you don't. So I don't know if somebody's not doing that, that's doing the BINEX and not sending them in, but we would send in the negatives and or the positives.
I'm sure some businesses probably got a hold of some and they use it to maybe keep their employees working. But anyway, I just did a quick to refresh myself too. So it has less sensitivity than the PCR test. So that just means that you can't rely on the negative test as much as you could a PCR. So just because it's negative doesn't necessarily mean that you don't have it, but it's a pretty good test, particularly if you're symptomatic. That's when you're supposed to use it.
Yeah.
If you have
So if a student came down and had a symptom for exclusion, we would contact a parent if we don't already have that on file and say, can we give them a test or not? And they say yes, we'll give the student and their siblings a test, and if they're negative, they can go back to class. So that would cut down on the 10-day, hopefully. So that's where the screening and testing comes in that section. Promoting vaccination. In fact, tonight, the EHS is having their physicals, and, working with Family Care and Associates, there's a voluntary test. So if parents or students wanted to get that test, they could have gotten that test this morning or this evening. So a strict.
Vaccine.
Oh, I'm sorry. Vaccine, sorry. So they get the vaccine. They could have gotten it tonight. It's readily available. I know the health department mentioned last week that they are doing, they're pretty much open, but they've been doing some trying to get more vaccinations and people participating. So, but that again, it's a parent family choice. Visitors, this was brought up. What it says in there is visitors, mentors, volunteers, including external groups, will be allowed in Unit 40 buildings. However, all participants are encouraged to be vaccinated and should follow the guidelines outlined in this plan. That's what's here. If the board wants to change that, this is a draft, so the board can change it how they want to put it. But in regards to some of the had to start somewhere, and this was some of the feedback that was received prior to even discussion of this that the board received and in conjunction with what other school districts are doing as well. So, questions on that part? Collaboration with public health officials. We had weekly, and we'll continue to have weekly meetings with the health department. As I mentioned earlier, in regards to metrics, and I asked last week that if I don't want something verbal, if they're going to recommend closure, I want it in writing. So hopefully, that's the case that we would need. If you want to make a decision from a board's perspective, that's fine as well. But in collaboration with that, any decisions or any recommendations for changes or alterations or, when we started this last year, started school last year, I think most people were hoping we'd get through 2 weeks before we got shut down. And we stayed open the whole year. And that's our goal this year. So, but things change, situations change, and we need to be open to adjust as we move forward. But those, in my opinion, need to be decisions made with the health department and local public health officials. And I think they have a medical committee, the health department does, with medical providers on their committee that they have reoccurring discussions with. Any questions on that? Disabilities and other healthcare needs addresses individuals. Those are usually held on a case-by-case basis. Because we're talking with students with IEPs or so on and so forth. So those are usually covered on a case-by-case basis. So those decisions are usually made from the IEP team and the nurses and so on and so forth. So, it's pretty. One decision might be for one student, and their needs might be different from another student. So, the plan reviewed no less than every 6 months, but obviously more than that. revised after considering input, revisions, if there are updated safety recommendations. I think those are, and we would verify that and share that with the public as well. So as information comes forward, we end up planning on sharing that. Additional details, student meals last year, and it will be continued. Student meals will be free for the 21-22 school year. So all student meals will be free, and believe we'll get reimbursement for that.
Is that students, teachers, principals, or?
I believe students. District following IHSA parameters when it comes to extracurricular. We're a member of the IHSA, and so, felt we probably ought to continue following those parameters.
The only thing that bothered me about that, and I assume that's not going to happen again because the IHSA backed out of it last year, was that they were going to go against the recommendation of the Illinois Department of Public Health at first, and then they changed their mind and backed off of that. I would not want to say we would automatically follow IHSA parameters, assuming that they're not going to do that again. I mean, I think they thought better of it after they had tried, at first and backed out of it, but that would be my only comment about that.
On athletic programs, we would run them as normal. Activity fees, admission charge, we didn't do those things last year. From everything we've heard, which could change, that the year's going to start on time and regular like we had back in the fall of 2020. So unless something changes, that would be the plan. Field trips and fundraisers are resumed following the safety protocols involved. Last year we cut on field trips. We didn't have those. And so, or they were limited. But if they are going to resume, we would follow all the protocols. So if that's required, masks are required in a certain building, then we would be following their protocols. The high school absences on the due to documented health department quarantine and isolation order will not count when calculating semester exam exemptions. One of the things that in talking with Mr. Roberts, bottom line is we would have finals the first semester. There's concern that we could probably talk with the curriculum committee about having accurate attendance, because that's based upon having good information from health department on who comes and who goes. And so attendance has been one of those parameters for finals. Everybody takes finals the first semester, but we've used attendance and grades and discipline and community service, those types of things, to be eligible to not have to take finals in the second semester. So there's still a question, and I think clarifying that with the curriculum committee in regards to how we can accurately handle the absences. If we can get that in an accurate count, then we'd probably be okay using that as one of the parameters. But if we can't verify, then that's going to be an issue. Anything to add to that, Mr. Roberts?
I think one of the things to consider in this is we're still in a position where we're asking people to be extremely cautious of symptoms and to put in place something that encourages them to come and possibly hide symptoms. I mean, we're walking a fine line here is probably not in our best interest at this time. So I think that looking at some type of alternative means, and we can do that through the curriculum committee and then ultimately through the board, as to what an exemption for the second semester final looks like. I think that's probably in our best interest, is to not put attendance in there as one of those criteria.
I think that's been a long-standing concern that some people have always had, that attendance was, that exams were being used as an attendance booster. So it'd be worth a conversation.
Yes.
Any questions for me? Okay.
So one of the possible changes, if you look on page 6, I handed out a copy of the plan. Has some highlighted on the last page. It was there sitting at your desk or sitting at your seat when you came in. Should be the last page, the highlighted portion. Some language that could be used would be, however, attendance may not be used as part of the exemption process. This is after discussion, right? Just throwing it out there. The district's curriculum committee will look into the situation further and possibly determine temporary final exam exemption criteria for the second semester. And that could be some language to put in there so everybody knows that could change. And then also just above that on the plan review, just understanding the plan must be flexible moving forward. The district may add or modify mitigation measures to classrooms, school buildings, or the entire district as needed during the school year to possibly prevent closures. These additional mitigations may include enhanced cleaning, required universal masking, and modified schedules, et cetera. Again, this is must be based upon what the decision is on masking. So, the district has the ability to require universal masking across the board. And maybe that might be if the metrics or the situation gets to that point, that might be something that through discussion with the health department, that might be an area of because we're in this plan, every other mitigation is being instituted. And we're stressing from the district's point of view if you're not vaccinated, the recommendation from CDC is you should wear a mask. But in the very next sentence or in the very next paragraph, it says the district can modify these mitigations on a one at a time. So it's up to the board on where we go with masks, but I think this language in there just it clarifies that there could be changes coming.
Yeah.
Because
you've got to have this kind of language. I just want to see us take a look at an approach like this to where we layer those mitigations based on the activity rate of a facility, not just, this is the most resilient group of the population, or children, correct? As far as their ability to deal with the virus. And I just would like to see us not go completely locked down, so to speak, before we give them a chance to even see how this goes. And that's where this language makes perfect sense. I think the health department should be able to give us some kind of guidance on what is an outbreak in a particular facility and what the expectation would be as far as further mitigations based on an outbreak. But I just would like for us to consider that before we put everything into place.
What about, what are you, for teachers and employees also?
I think that's something that, when we were talking about this earlier and
Right.
Michael had given his opening comments, I was thinking to myself, how much have we really surveyed the teachers and the other personnel as far as what their thoughts are on that? We got their feedback specifically on other topics in the past. I think it would be worthwhile to get more detail about how they feel about the topic.
the survey was sent to emailed to every employee.
Oh, it was? Okay. I didn't know if they had to go out just like everybody else.
Nope. We emailed it to every employee, whether teacher or not. And then we sent it out to public as well.
So we don't know what percentage
Right.
that weighs.
I don't know, obviously there'll be some people that would not favor that, obviously. But I guess it boils back down to the way I look at it is as an employer, it's our responsibility to do that, and they still have a choice, kind of thing. So I'm sure there's some people that would not think it was a good decision, but there's a lot of things that teachers have to do that maybe just to be in the classroom. A lot of things people don't even understand, like heaven forbid that, to wear a t-shirt or a shirt that had any kind of political persuasion on it. You cannot do. I mean, there's all kinds of things as teachers that you can't do in order to protect some part of the experience at school. So to me, this is like a supreme responsibility. It's the health of our safety of our kids. And I mean, is it foolproof? No. But is it maybe a step in the right direction? Well, we would hope so. So, I don't know. And visitors too.
And a lot of them have the experience because they've been through it last year, so they know what they're up against, so.
Right. And they have a choice.
Mhm.
You know, we're not requiring them to do anything. They have a choice.
All right, so
You also do have a segment of employees that do not have a choice, and that's our bus drivers.
Right. And whether they're vaccinated or not, they have to be masked.
one of the issues that came up when we started this, gosh, I don't know when, but we talked about masks versus shields because it's very important in the feedback from elementary teachers, especially in teaching phonics, needing the need to have students be able to see the phonetic pronunciation and understanding of words and chunks of words. So if the board wishes to have teachers and staff must wear masks unless they provide vaccination documentation, I would ask at least we have the ability to use shields at the lower levels in regards to teaching of, I don't know what, if you just say phonics, because there's something I'm missing, I'm sure.
Maybe.
Okay.
I've seen those, so I've seen good shields and bad shields. We have some shields at work that, kind of come down all the way. I've seen shields that in businesses where people chose to wear this instead of a mask and they came down to here. And I'm like, I don't really think that's doing anything. So I think if maybe they were provided with it's something that's the school could provide maybe, that it was approved.
Well, I think we purchased some last year, correct?
I think the school did. I don't know what they were, but were they approved? Good ones?
We purchased.
Jennifer probably saw some of them.
Yeah.
Do you have any thoughts on
They
this?
came down quite a bit further down.
Any thoughts on this?
On the shield.
Yeah. What are these shields look like?
So I know the French teacher at the high school used it.
Did it come down pretty far?
It came down to around here, definitely closer to the neck. And I, as a choir teacher, I would agree that at least something having there, I would use the face shield. Sometimes I would forget it at home a lot. So, but I mean, it does help with the phonics. For me, it helps with the oral shape and how to get the vowels and how to get all those consonants and everything for the students to make sure it's matching, because that's my job to make sure it's blending. And definitely for Central, my only concern is that with the studies that have shown with the face shields and how you were saying that they're not completely 100% effective, because a lot of the ones that are out, they don't have the curve.
Right.
So you still have the particles going backwards through the shield, so it's not as effective as.
I know it's hard. It's going to be hard throughout the school year to manage all these things, but I think there would be some situations where a shield would be beneficial when they need to see your lips. So if you could be distanced from the students while you're giving that instruction with the shield, then maybe there are appropriate
Right.
times to.
And I think that was across, there were different levels that was used last
But
year.
in general, when you're at a student's desk, when you're, in closer proximity, a face mask is what should be used. But if you have to give instruction where they need to see your lips, then a shield would be okay.
I know a lot of the foreign language teachers, they would just step back to where they're completely distanced, and they would still have the mask on over the shield, but to show like the pronunciations and like how to say the words in the foreign language, they would just put the mask down while still wearing the shield so that they can still see how to properly do it and how to properly make those adjustments, the phonics, as you were saying.
Okay, thank you.
Thanks.
Okay, so I guess to move things forward, I've heard different things. I mean, right now indoors, mask is recommended for people who are not fully vaccinated, including students, teachers, staff. However, this one prevention strategy will be optional. So we're going to make a different, are we making a different bullet that's saying teachers and staff must wear masks unless they provide vaccination documentation?
That would be my preference,
Well,
but I don't
yeah,
know.
that's what I'm asking.
The majority of
I
the
don't-
board's
that-
preference.
Or are we leaving it as is? 'Cause when- As you're thinking about that, I'll keep going. Page 4, we're going to talk about voluntary vaccination records from parents for those students who are vaccinated. So we're going to ask for that information. And then we will be giving the list of close contact with those who are fully vaccinated to the Effingham County Health Department. And then on page 6, we're going to add the bullet that says this plan must be flexible. And then I was planning to cut the other bullet.
On page 5, we
Did I
also
miss
said
something?
if we change the masking for teachers and staff, we were also considering the visitors to the building. Same parameters. Proof of vaccination or masks. If we went with, well, I guess.
So it'd be,
tied to that one.
so however, all participants, all unvaccinated,
Well, I would just say all participants must provide proof of vaccination or wear masks. Isn't that what we're asking for visitors? Or that, if we changed it?
then page 6, under plan review, we'd add the plan must be flexible moving forward, may add or modify mitigation measures. And then at the very bottom on additional details, and that at the end of that bullet, there will be finals. However, attendance may not be used as part of the exemption. The district's curriculum will look into this situation further and determine final exam and exemption criteria for the second semester. And we can do that pretty quick. I mean, we can have a meeting, bring it back. So I guess the question is, it's back to the mask issue.
I know that we don't have exact data, but do we have a guesstimate of the percentage of our staff that's vaccinated? They were allowed-
General population?
They were allowed to go earlier than most
Right.
people. Do we know?
Well,
what the response
In the spring, I think, I don't know from, it's 4 months ago.
60-something.
Well, I don't, it was around the 50. I don't know if it was above 50. I'm guessing. I'm looking out there.
50
I'm looking
people.
outside thinking.
50% or 50 people?
No, percentage.
50%.
We had quite a few when they had the educational. I don't know. You shouldn't make a decision on the data that I'm guessing at, I guess.
I know we don't have the data. I'm just curious.
Yeah.
And, an educated guesstimate.
We don't know.
Well, if we ask for the information, we'll know, right? But, if they say, no, I don't want to give it, then it's a negative. Doesn't mean they're not.
Doesn't mean
Somebody could say, could be vaccinated, I'm just not sharing it. I don't know why they do that, but. So.
I would be more comfortable if you surveyed them, at least ask the information. We've done
Yeah.
that where I'm at.
Yeah.
It's not,
And I think that's what we would do as part of this.
give you a better data point.
so. Should we ask for
What
the
are we
ask
asking
for the
them?
survey first before we?
If they're vaccinated, we're going to
before-
ask them if they're vaccinated?
You can ask them.
Yeah.
Yeah.
Are you saying ask them in order for us to make a decision? Is that what you're saying?
It'd be a data point in that decision, yeah. It'd be an anonymous survey just to your teachers and staff.
Not sure how that would help me make my decision, but
Well, one of the issues with that is you have people still taking back vacations and things like that. So, it was sent, the survey was sent out. We can do that. I can't guarantee what percentage we'll get back, but. I mean, we can definitely ask that and see what the hand is.
I'm just offering up there. If it's not going to make a difference in anybody's decision, then we don't need to do that. I don't know what you've done in the past on a decision this big, whether and you don't have a full board here, whether you reschedule that or how that's handled.
Well, and it would just depend, without, taking a formal vote. If there were, I agree that I don't think it's a decision that should be made if there's just 3 people here tonight, which would be a majority that favored it. You understand what I'm saying? I think it should wait for the full board. If there's 4 people tonight that favor it, then that would be a majority anyway, even if the full board were here. So I don't, you see what I'm saying?
Mhm.
I don't think it would be right to make that decision with a 3-person majority, I guess is what I'm saying.
Okay.
Which could be done tonight, right?
The one thing to keep in mind is you're kind of up against the clock too, because if there's somebody who's not vaccinated, who does not want to wear a mask, but they find out in August that they're going to have to wear a mask because they're not vaccinated, they don't have time to get vaccinated, fully vaccinated before school starts. If you make the decision sooner than later, teachers have the opportunity to still go get that whole process done, become fully vaccinated before school starts and students show up on the 25th.
Right.
So the sooner we can make this decision, the better it is for those staff members who aren't
I
vaccinated.
agree. I
But-
think it could wait till the August meeting.
No,
It would
we're
just be
going to have
whether it's made,
other meetings, I'm sure.
But,
So-
only 2 weeks with the J&J and they would be fully vaccinated.
But I think, even on the flip side, there's always 2 sides to everything. So, some people could say, well, they've had opportunities to get vaccinated since March or April or June, and they haven't. Now, this May, if that's the way the district goes, somebody may say, well, I'm going to get it because I don't want to wear the mask. Okay. If they can't, then it may be a week or 2 or 3 or 4 weeks they have to wear a mask until they're fully vaccinated. But some things you control and some things you can't. I always have people that are saying, well, if they made the decision not to get vaccinated so far, what's the percentage that are going to turn around and get vaccinated now? That may change with their student or their child because of quarantining and all these other things. That may change. And I think I made that comment at the health department. That's something that I wouldn't be surprised if we had more students get vaccinated because they don't want to face being quarantined. They don't want to, just common sense. And I'm strictly voluntary. They could or they couldn't. That's up to them. But I think you'll have some people, families, that'll sit down and say, no, I'm not going to. And you have others say, well, you could be quarantined 14 days every time. And they could turn around and say, or they could say, I'm doing this for safety or whatever. And that's a decision for the family and the parents. So.
Okay. So what do we want to do this evening? We want to wait and have a special meeting? Do we feel like we have a four-person majority either way tonight?
In what part are you asking? To approve this draft or to add the language as
I
it
think we're
relates
talking
to the
about
fact?
adding the language about staff and teachers either providing proof of vaccination or mask. I think that's what we're debating. whether
And
we would-
visitors.
And visitors, yeah. Whether we would alter that part of the plan. That was really the only major change other than a minor language.
I would vote for that.
Yeah, obviously I would too. I mean, we've kind of made ours and Jane wouldn't, yeah. But so it.
I would not be prepared to support that.
Okay, well then I think that we should wait for a full board
Okay.
before we would consider it because that even, no matter, I wouldn't even ask Jill, so. Well, I mean, what I said before was, I don't think for a decision of this magnitude, it should be something we pass with a three-person majority, which we could do
Right.
tonight with 5 people present.
Right.
I think it should.
I wouldn't feel good about that.
Which should be something, if there were 4 of us here tonight that would vote for it, then that would be different because that would be a majority with a full board. But, so.
As direction, making the potential changes absent, you can put it all in highlighted, update what was discussed this evening and send it out so everybody could look at it, make sure I got the right feedback
Right.
involved. And then I'm sure we're going to have a meeting here. We
Right.
could set up a
Should-
special
should-
meeting or
yeah.
to have this because again, whether it's, next week, I just need to finalize when everybody can be here. And we could do it at 5, if we need to do it at 5:00, that's fine, or 6, whatever. So, we'll move forward with that. Is that okay?
All right.
I do have a question about testing too, because the IASB sent out notification that the schools were going to have access to the saliva test.
Okay,
that
so,
the-
yeah.
that
The shield.
University of Illinois, the shield test, yes.
So here's the parameters on the shield test. Because I've set two different webinars on that because we looked at it in the summer it's a preventative or screening test. So they're requesting, the first number they shared was 60% of your student body and staff be tested once a week. And whether they're positive or whether they've been vaccinated or not. And to be able to do that would be disruptive in regard, 60% of our people getting tested every week. We can do that if the board wants to, felt it was too much disruption. And in regards to whether, we would have people not want to be tested, we couldn't hit that threshold. Set down through another one. Even with the health department, they asked about that and nobody in the county from the other school districts felt that they wanted to do that and force people to get that test. Now, you could do it, I guess you could do it voluntarily, but you're talking even if they dropped it to 40%, you're talking or 50%, half of your students at all getting tested. So, and they can say, yeah, it only takes 10 minutes. It doesn't just take 10 minutes. It's going to be it would be a big disruption. But if that's what the district wants to do, we'll do that. But
How did the university logistically do that? Does anyone know?
well, they had people there all the time, 24 hours. I mean, I think students had to get tested at least once a week, if not more. Did they do that at Decatur in Milliken?
With their athletes, they had to be tested every 3 days.
kind of where we're at on that.
Okay.
Okay, I'll update those.
Okay, I think that was the last item on our agenda. We are ready to enter into closed session. If I have a motion and a second.
Make a motion.
Chad, motions that we enter closed session, second?
Second.
Bill, second, roll call?
Excuse me.
Robin,
Yes.
Jill,
Yes.
Jane, yes, Chad.
Yes.
Thank you.